So I started working on program evaluation, which is a traditional topic in labor economics. And then a lot of the programs that I was interested in had health as an important focus. And so I would say that was the way that I sort of moved from labor economics to health economics. But I also think that what you said about them being related is really true. They're both types of human capital. Education and health are both really important to things like having a productive workforce. And so I like to encourage people to think about them using the same framework and not thinking about them as being totally separate things. So I think the emphasis on early childhood is very important in a country like Ecuador. Understanding that conditions for pregnant women, for women even before they become pregnant, is going to affect the child, and that things that happen when children are very young are going to affect how able they are as workers when they're adults. I think all of that is especially important in developing countries where a lot of the population is young and it's relatively inexpensive to invest in better maternal and child health, and that could have a big payoff. So in the US, I think the really important takeaway is that the programs were effective, because in the US there's often a perception that public programs don't work very well, that private programs are better, that if the government is doing something that they're not doing a very good job. So it's important to say, okay, here's an example where the government did something. There was actually a lot of consensus at the time that they did it, that this was really important. Everybody agreed that they should invest in children. They invested in children, and look, it's had a big payoff. See big declines in infant mortality, big declines in child mortality, better child health, better young adult health now among those cohorts. So I guess one takeaway is that it's important to track these programs over a long period of time to see what the effects are. And that would be something that would also be important in a country like Ecuador, where maybe every government that comes in has a program, they want to do something, the program rolls out, and then nobody knows really what happened. And so all you see is, well, there were a bunch of programs, and we don't really see evidence that they were effective, often because nobody really looked carefully at whether they were effective or not. And that can make the public very cynical about whether they should have another new program about something. So I think a lot of the frontiers actually have to do with better measurement. In the sense we have a few health measures that we've used a lot, like things like infant mortality, birth weight, in developing country contexts, people often look at things like height for age or weight for height as measures of child health. But we have so much better data now in a lot of countries that you could put together a much more fine-grained index of child well-being, and also realize that not every program is going to affect every index. Some, like a nutrition program, may affect height, but maybe not so much test scores, whereas an early childhood education program may have more of an effect on test scores. So trying to have better measures and more closely link the measures to the program that you're trying to evaluate seems like I know that sounds kind of low tech. You could do it in a high-tech way if you want, with machine learning or something like that, but fundamentally it's about coming up with better measures of the concepts that you're trying to capture and thinking carefully about what is the concept that you're trying to capture.